Hello, everybody. This is Coresair Mack, now past president of the Illinois Mental Health Counselors Association. And today, in our mental health news, we're going to take a look at how Illinois did from 2022 to 2023 in regards to mental health. So sit back, relax, and enjoy the video. Alrighty. So, in regards to where I got the information, I went to mentalhealthamericanational.org or MHAnational.org to get all the statistics from the 2022 to the 2023 year. And we're going to take a look at both adult and youth statistics in regards to how we did in Illinois in regards to ranking with all the other states in the United States. So what we're going to do, we're going to flip back and forth from this just to get more information, but let's take a look at the measures. All right, so as we take a look here at mhanational.org, again, all this will be linked in the description. We take a look at the different guidelines. So first, the MHA guidelines. Given the variability of data, MHA developed guidelines to identify mental health measures that are most appropriate for inclusion in our ranking. Chosen indicators met the following guidelines. So first one, data that are publicly available and as current as possible to provide up-to-date results. Second one, data that are available for all 50 states and the District of Columbia. Data for both youth and adults. Data that captures information regardless of varying utilization of the private and public mental health system. And data that could be collected over time to allow for analysis of future changes and trends. So when we take a look at all the different things that we're going to take a look at, we're basically going to take a look at all of that. And again, you can find both last year's data and the year before's data here on the website as well. You can also go here to download the 2022 to 2023 printable report. The 2021 to 2022 printable report. But let's get into the data. And like I mentioned, we're going to flip back and forth from the PowerPoint that I presented that basically summarizes the information here to what they're providing here. So let's get into it. Alrighty, so now let's take a look at how did Illinois do in the past year. And again, special thanks to Mental Health of America for the data from the 2023 to 2023 years. That way we can compare it to the prior year. All right, so first off, overall ranking for Illinois. So again, number 1's the best to number 51 or 52 is the worst. So in 2021 and 2022, we ranked 12th. And then from the 2022 to 2023 year, we ranked 9th. So it looks like in this past year, we did better. But let's see what specific areas did we do better in and what specific areas did we do worse in. All right, so what I'm going to do, I'm going to go over the quick overview of this. And then as we get into it, again, I'm going to flip-flop between the two so that way you can see what they're specifically looking for. All right, so first, adult ranking for Illinois. So in the 2021 to 2022 year, we ranked 10th, which isn't bad. I think they said the top 13 is good. And then in the 2022 to 2023 year, we ranked 9th. So our ranking went up. So that's actually good. So now let's take a look to see how that compared. All right, so now that we're here, we're going to take a look at the adult ranking of 2023. So if we just scroll our mouse over here to Illinois, it shows that we're ranked 9th. So if we scroll down here, we take a look to see states that are ranked 1 through 13 have lower prevalence of mental illness and higher rates of access to care for adults. States that are ranked 39 to 51 indicate that adults have higher prevalence of mental illness and lower rates of access to care. And the 7 measures that they took a look at were adults with any mental illness, adults with substance use disorder in the past year, adults with serious thoughts of suicide, adults with any mental illness who did not receive treatment, adults with any mental illness reporting unmet needs, adults with any mental illness who are uninsured, and adults reporting 14 plus mentally unhealthy days a month who cannot see a doctor due to costs. And again, we're going to go over each one of these in a little bit, but I want to show you what they were ranking there. All right, now we take a look at youth ranking for Illinois. So in the 2021 to 2022 year, Illinois is ranked 12th. And from the 2022 to 2023 year, Illinois is ranked 13th. All right, so it looks like we went down 1 rank. So let's see specifically what they're measuring for the youth ranking. All right, here we are with the youth rankings. So let's see here. Illinois is ranked 13th. So let's see. So basically this stated the same thing as for the adults, but here are the measures that they're using for the youth ranking. Youth with at least one major depressive episode in the past year, youth with substance use disorder in the past year, youth with severe major depressive episodes, youth with major depressive episode who did not receive mental health services, youth with severe major depressive episode who received some consistent treatment, youth with private insurance that did not cover mental or emotional problems, and students K plus identified with emotional disturbances for an individualized education program or IEP. And K plus is K through 12 in this instance. So this does not include students who go to secondary education like community college, universities, and things of that nature. All right, next we take a look at prevalence of mental illness for Illinois. So in the 2021-2022 year, we ranked 16th. And for the 2022 year, 2023 year, we ranked 31st. All right, so it looks like we went down significantly. So let's take a look to see what they measured for that. All right, here we are with the prevalence of mental illness in 2023. So of course, we scroll over, ranked 31st. And when we take a look at here, what they're measuring, let's see. Adults with any mental illness, adults with substance use disorder in the past year, adults with serious thoughts of suicide, youth with at least one major depressive episode in the past year, youth with substance use disorder in the past year, and youth with severe major depressive episode. Again, we're going to get into those in a little bit, but those are the measures that they're utilizing. All right, now we take a look at access to care in Illinois. So in the 2021-2022 year, Illinois is ranked 13th, and then the 2022-2023, we shot up to 3rd. So looks like we were able to provide more access to care here in Illinois. So let's take a look to see what they measured that as. All right, here we go with access to care. And again, if we scroll here, it shows that we're ranked 3rd. So let's take a look, see. Access ranking indicates how much access to mental health care exists within a state. The access measures include access to insurance, access to treatment, quality and cost of insurance, access to special education, and workforce availability. A high access ranking indicates that the state provides relatively more access to insurance and mental health treatment, which is the 1 through 13. And the 9 measures that make up the access rating include adults with any mental illness who did not receive treatment, adults with any mental illness reporting unmet needs, adults with any mental illness who are uninsured, adults reporting 14 plus mentally unhealthy days a month who cannot see a doctor due to costs, youth with major depressive episode who did not receive mental health services, youth with severe major depressive episodes who received some consistent treatment, youth with private insurance that did not cover mental or emotional problems, students K plus identified with emotional disturbance for an individualized education program, and mental health workforce availability. Right, so that's interesting. Again, we're going to get into some of those in a little bit. All right, now that we're here, let's take a look at mental health workforce availability in Illinois. So from the 2021-2022 year, Illinois is ranked 28th with 410 individuals to 1 mental health provider. And then 2022 to 2023, we were still ranked 28th, but we did a little bit better with 370 individuals to 1 mental health provider. So that's good. So let's see what they measured that as. All right, when we take a look at mental health workforce availability, of course, just like we mentioned, we are ranked 28th. So let's see here. In the U.S., there are 350 individuals for every 1 mental health provider. The term mental health provider includes psychiatrists, psychologists, licensed clinical social workers, counselors, marriage and family therapists, and advanced practice nurses specializing in mental health care. Let's see, as of June 2022, over 152 million people lived in a mental health workforce shortage area, and only 28% of the mental health need in shortage areas was being met by mental health providers. The state rate of mental health workforce ranges from 140 to 1 in Massachusetts to 850 to 1 in Alabama. Wow. Did not know that. All right, so now let's take a look at some of the adult mental health with the different things that they measured it with. All right, so now that we're here, let's take a look at the comparison data from the previous year to this past year. All right, so adult prevalence of any mental illness in 2021 and 2022, we ranked 11th, meaning 19.18% of our adult population in Illinois had any mental health illness. And now in 2022-2023, we ranked 15th with the number going up to 20.72%. In regards to substance use disorder from the 2021 to 2022, we ranked 31st with 8.02% of our adult population having a substance use disorder. And again, from 2022 to 2023, that shot up to 35th, with it pretty much doubling or going a little bit over the double with 16.69%. Adults with serious thoughts of suicide, again, the 2021-2022 data shows that we were 5th with 4% of our adult population having serious thoughts of suicide. Then the 2022 to 2023 data show that we went up to 12th, with it going up to 4.54% of our adult population. And also adult with any mental illness who are uninsured, 2021 to 2022 showed 14%, which is 7.1% of our adult population. And 2022 to 2023 showed that we are in 9th, which us going down to 6.3%, so that's good. And then next up, adults with any mental illness who did not receive treatment. 2021 and 2022 showed that we were in 20th place with 52.6% of our adult population not receiving treatment. And it looks like it showed up in ranking but down in number. So from the 2022 to 2023 year, we're ranked 23rd, with us going down to 50.9% of our adult population. And adults with any mental illness reporting unmet needs, 2021 to 2022 year, we were ranked 16th with 23.2% of our adult population report unmet needs. And it looks like our ranking went down, but our numbers went up in the 2022 to 2023 year, us being 14th ranked, but 25.9% of our adult population reported unmet needs. All right, and then lastly here, adults reporting 14 plus mentally unhealthy days a month who cannot see a doctor due to cost. The 2022 to 2023 year showed 14th, with us being at 19.29. And the reason why I didn't include the 2021 to 2022 year, it was an unfair comparison because they labeled it as something else, which I will show you all in a second. Alrighty, so basically what I was talking about is this: adults with cognitive disability who cannot see a doctor due to costs, which is something that's very much different from what we just took a look at. But since we're here, let's take a look to see how Illinois did. Here we go. We are ranked 42nd here at 32.25% of our adult population. But again, like I mentioned, it's an unfair comparison since they're measuring two different things, but that should be noted. Alrighty, so we're going to take a look at a few of these so that way you know specifically how they measured them. And then after that, we're going to get into the youth. So first, adult prevalence of any mental illness. So essentially, just like I mentioned, we are now ranked 15th with 20.72% of our adult population having any mental illness. Essentially, according to SAMHSA, any mental illness is defined as having a diagnosable mental, behavioral, or emotional disorder other than a developmental or substance use disorder as assessed by a mental health surveillance study, structured clinical interview for the Diagnostic and Statistical Manual of Mental Disorders, 4th edition, and then, all that stuff you can read there. All right, so for the next one, if we scroll down, we take a look at adults with substance use disorder in 2023, and just like what I mentioned, we are 35th with 16.69% of our adult population having a substance use disorder for the 2022 to 2023 year. And some statistics they give: 15.35% of adults in America reported having a substance use disorder in the past year. 6.82% of adults in America had an illicit drug use disorder in the past year. 10.96% of adults in America had an alcohol use disorder in the past year. Of those reporting having a substance use disorder in the past year, 93.5% did not receive any form of treatment. The state prevalence of adults with substance use disorder ranges from 11.31 in Georgia to 21.21 in the District of Columbia. And again, they define substance use disorder based on the criteria from the DSM-5. So that's where they got that from. And next up, when we take a look at it, we take a look at adults with serious thoughts of suicide. And again, we are ranked 12th with 4.54% of our adult population having serious thoughts of suicide. In statistics they give here, the percentage of adults reporting serious thoughts of suicide is 4.84%. The estimate number of adults with serious suicidal thoughts is over 12.1 million. 11% of adults who identified as two or more races reported serious thoughts of suicide in 2020, which is 6% higher than the average among all adults. The state prevalence of adults with serious thoughts of suicide ranges from 3.92 in Georgia to 7.63 in Utah. So that's where they got those from. Okay. And then next up, we go down to adults with any mental illness who are uninsured. And again, 6.3% of our adult population fits that criteria. So 10.8% or over 5.5 million adults with any mental illness, or with a mental illness, are uninsured. The state prevalence of uninsured ranges from, and then you can see the ranges there. And then next up, when we go down, adults with any mental illness who did not receive treatment in 2023. Again, that's 50.9% of our adult population here in Illinois. So over half, which is 54.7% of adults with a mental illness received no treatment. Over 28 million individuals experiencing a mental illness are going untreated. Of adults with a mental illness who did not receive treatment in the past year, 26.7% indicated that they had experienced serious psychological distress in the past month. And then you can see the state prevalence down there. And then next up, adults with any mental illness reporting unmet needs. And again, we are 14th, which 25.9% of our adult population here in Illinois. So here, almost a third, or 28.2% of all adults with a mental illness reported that they were not able to receive the treatment they needed. Individuals reporting unmet needs are those seeking treatment and facing barriers to getting the help they need. Cost of care remains a significant barrier for many individuals in the U.S. Most adults with any mental illness who reported unmet needs for treatment indicated that they did not receive care because they could not afford it, which is at 42%. The state prevalence of adults with any mental illness reporting unmet treatment needs ranges from 18.4. Well, you can read that for the state prevalences. All right, so now that we're almost down to the last one, here we go. So adults reporting 14 plus mentally unhealthy days a month who could not see a doctor due to costs. Again, Illinois, we're ranked 14th, which is 19.29% of our adult population. So 22.87% of adults reported experiencing 14 or more mental health days each month that were not able to see a doctor due to costs. Mentally unhealthy days are derived from the question, now thinking about your mental health, which includes stress, depression, and problems with emotions, for how many days during the past 30 days was your mental health not good? Having 14 or more mentally unhealthy days each month is defined as experiencing frequent mental distress. And again, it gives the state prevalence down here. And I believe that should be it for that one. All right, so now that we've gotten through that, let's now go through the youth. All right, now let's take a look at youth data comparisons from 2 years ago to last year. So youth with at least one major depressive episode in 2021 and 2022, we were ranked 22nd with 15.15% of our youth population, again 17 and lower, identifying as having one major depressive episode. And now last year we were ranked 37th with 18.1% of our youth identifying as that. So youth with severe major depressive episodes. So 2 years ago, we were ranked 24th at 11%. And last year we went up to 40 with 14.4%. So that coincides with the prior data. We went up from 15 to 18, and here we went up from 11 to 14. So now youth with substance use disorders. 2 years ago, we ranked 27th at 4.25%. And last year, we ranked 41st with 7.19% of our youth population identifying as having a substance use disorder. And then, so could there be a possible correlation? Could be. Something that we have to take a look at. Next up, youth with major depressive episode who did not receive mental health services. Again, 2 years ago, we ranked 20th with 55.2%, but now we are ranked 6th, which is a huge jump up in the right direction at 39.9%. So now youth with severe major depressive episode who received some consistent treatment. 2 years ago, we ranked 8th at 38.3%, and now we ranked 7th at 44.7%. So we went up in ranking, which is good, but ultimately we had an increase, which is bad. All right, so now we take a look at the next slide. So now youth with private insurance that did not cover mental or emotional problems. 2 years ago, we ranked 19th at 6.6%. Now we rank 3rd, which is a huge jump up, at 5.3%. And next, students K plus identified with emotional disturbances for an individual education program. 2 years ago, we ranked 14th at 10.59%, and now we went up, ranked 13th at 9.76%, so that's moving in the right direction. All right, so now that we took a look at that, let's go ahead and take a look at the data on the website. All right, now let's take a look at the data and what they measured with here. All right, so first, youth with at least one major depressive episode in the 2022-2023, so last year, we ranked again 37 with 18.1% of our youth population having at least one major depressive episode last year. So here, 16.39% of youth ages 12 to 17 reported suffering from at least one major depressive episode in the past year. Youth experienced numerous hardships during the COVID-19 pandemic. The CDC's Adolescent Behavior and Experiences Survey found that 67% of U.S. high school students reported that schoolwork was more difficult, 55% experienced some emotional abuse in the home, 11% experienced physical abuse, and 24% report they did not have enough food to eat during the COVID-19 pandemic, all of which can have a detrimental effect on mental health. All right, and you see the state prevalences down here. So now let's go down to the next one, and those statistics were very sad, by the way. So now youth with severe major depressive episode from the past year, and of course we're ranked 40th with 14.4% of our youth population reporting that they've had severe major depressive episode. So here, 11.5% of youth, or over 2.7 million youth, are experiencing severe major depression. Rates of a severe major depressive episode were high among youth who identified as more than one race at 16.5%, about 123,000 youth. The percentage of youth with severe major depressive episode in South Dakota is ranked 51, is nearly 4 times the percentage of youth in South Carolina. And then you can see the state prevalences there. All right, so next up then we go to youth with substance use disorders in 2023. So again, we ranked 41st with 7.19% of our youth identifying as having a substance use disorder. And here we go, 6.34% of youth in the U.S. reported a substance use disorder in the past year. 2.85% had an alcohol use disorder in the past year, while 4.85% had an illicit drug use disorder. And again, it gives the state prevalence down here. And next up, we go to youth with major depressive episode who did not receive mental health services last year. And again, we were ranked 6th with 39.9% of our youth identifying again as not receiving mental health services last year. So here, 59.8% of youth with major depression did not receive any mental health treatment. And again, in Kentucky, Hawaii, and Texas, 3/4 of youth with major depression did not receive mental health treatment. In South Carolina, the lowest ranking state, nearly 8 in 10 youth with depression do not receive care. And it gives the state prevalences down here also. All right, so next, youth with severe major depressive episode who received some consistent treatment in 2023. So here we were ranked 7th with 44.7% of our youth population identifying as receiving some consistent treatment in 2023. So that's good. Nationally, only 28% of youth with severe depression receive some consistent treatment, 7 to 25 plus visits in a year. 14.7% of youth with severe major depressive episode receive 1 to 6 visits in the previous year. Most, which is 57.3% of youth with severe depression, did not receive any care or do not receive any care. I apologize about that. All right, and again, something important to remember down here, high percentages are associated with positive outcomes and low percentages are associated with poor outcomes. And then next up, we take a look at youth with private insurance that did not cover mental or emotional problems in the past year. And again, we are ranked third, which is 5.3% of our youth identifying as having private insurance that did not cover mental or emotional problems. All right, so nationally, 1 in 10 youth who are covered under private insurance do not have coverage for mental or emotional difficulties, totaling over 1.2 million youth. And again, in Arkansas, that's ranked 51. Nearly 1/4 of youth with private insurance do not have coverage for mental health care. And it gives you the state prevalences down here. All right, and then next up, we take a look at, this might be the last one, students K plus identified with emotional disturbance for an individualized education program or an IEP. And here we are ranked 13th with 9.76% of our youth identifying with an emotional disturbance for an individualized education program. So only 0.718% of students are identified as having an emotional disturbance or ED for an individualized education program. For purposes of an IEP, the term emotional disturbance is used to define youth with a mental or behavioral health condition that is affecting their educational performance. The rate for this measure is shown as a rate per 1,000 students, and a calculation was made this way for ease of reading. Unfortunately, doing so hides the fact that percentages are significantly lower. And then again, it gives you some of the rates down here. State rate of students identified as having an emotional disturbance for an IEP ranges from 30.60 per 1,000 students in Vermont to 1.82 per 1,000 students in Alabama. It gives you those here. And that should be the last one. All right, so before we end, I want to take you to some data that shows racial disparities as well in regards to mental health access in our youth. That's found in the 2021-2022 report here that you can download from this website as well. And I will show you that in a second. All right, so now we're here. We're going to take a look at the spotlight disparities in mental health treatment for youth of color for the 2021 and 2022 data. So when we take a look here for of youth with major depressive episode, or actually before we even take a look at that, first, the following analysis are based on data from the 2018-2019 SAMHSA National Survey on Drug Use and Health. So first, while rates of mental health treatment are low for all youth with major depression, youth of color are significantly less likely to receive depression treatment than white youth. Asian youth were least likely to have seen a health professional or receive medication for their depression, followed by Black or African American youth and Hispanic youth. All right, so now we get into the individualized questions here. So if youth with major depressive episode, did you see a health professional or receive medication for depression in the past year? So when we take a look at the yes, it looks like here white Americans received 22%, which is the highest, to Asian Americans receiving 8.3%, which is the lowest. And again, when we take a look at here, these analyses not only reflect disparities in who get to receive mental health treatment, but what kind of services they are able to receive where they can access care. Youth of color with major depression were less likely to receive specialty mental health care than white youth. Specialty mental health treatment is defined as staying overnight in a hospital, staying in a residential treatment facility, spending time in a day treatment facility, receiving treatment from a mental health clinic, receiving treatment from a private therapist, or receiving treatment from an in-home therapist. And again, as we took a look here, Asian American youth were with With the past year, major depressive episode were least likely to have received specialty mental health care. Then that's followed by Native Americans or Alaskan Natives, then Black or African Americans, then white Americans. All right, and then again, over half of white youth within the past year major depressive episode did not receive treatment. So that's something important to remember. All right, so next, out of youth with major depressive episode did receive specialty mental health care in the past year. And again, in regards to the yes, we see that the highest form here is white American youth, and the lowest form here again is Asian American youth. Okay, so again, Native American, Black, and multiracial youth were all more likely to receive non-specialty mental health care than white youth. Non-specialty mental health care is defined as receiving services from a school social worker, school psychologist, or school counselor, special school or program with a regular school for students with emotional or behavioral problems, pediatrician or other family doctors, juvenile detention centers, prisons, or jails, or foster care or therapeutic foster care. And again, it gives you the statistics there that we read. All right, so then the next one here. Of youth with major depressive episode, did you receive non-specialty mental health care in the past year? So out of the yeses, we take a look at Native Americans being the highest at 43.3%, or Native American or Alaska Native children, and then the lowest being Native, Hawaiian, or other Pacific Islanders. All right, so of the 18.1% of youth who received non-specialty mental health services in 2019, most, which is 15.4%, received those services in school. Despite the fact that youth of color comprise less than half of the total population of youth with major depressive episode, 52% of youth with major depressive episode who only received care in educational settings were youth of color. Of youth with major depressive episode, Black youth were most likely to receive school mental health services, which is at 37%, followed by Native American or Alaska youth, which is at 35%, and multiracial youth, which is at 34%. All right, so the next one, did you receive mental health services from educational sources? So when we take a look here, the lowest percentage here that answered yes were Asian American youth, with the highest percentage being youth Americans that identified as more than one race. Nope, actually that's wrong. The highest percent being Black or African American youth. All right, so students of color disproportionately access their mental health care at school, often because they do not have access to specialty mental health services. Given this data, increasing access to school-based mental health services can promote equity and reduce disparities in access to care. However, there is not sufficient federal funding for local education agencies to meet the mental health needs of students. To create healthier communities and to better serve students of color who may only receive mental health services in educational settings, schools need long-term financial support to build up sustained and sufficient school infrastructure. This infrastructure should include, at minimum, implementing comprehensive mental health education, increasing the number of mental health providers in schools, creating connections and coordinating with community-based mental health services, identifying processes and supports for screening and treating students, and reducing the gap in care when students transition from school to college and college to the workforce. Although some states have adopted innovative practices to improve mental health education and access to mental health services and supports in schools, no state has fully enacted a set of laws and policies to improve youth mental health. Mental Health America has compiled a report on innovative state policies and recommendations for future state legislative work geared towards servicing the mental health needs of students and advancing equitable access to supports in schools. Alrighty, so now that you've seen the data, yes, it looks like we overall did better, though that also doesn't really take into account how other states did, as well as how, even though our ranking went up, the amount of our population also went up as well. So, of course, thankfully we did better, but there's still more to do. So it looks like we still have a lot more work to do. But please let me know down in the comments what you think. Did any of that data surprise you? Did that seem like it was on mark for what you were all thinking? Yeah, definitely let me know. But that's going to be it for me. This is Coresair Mack, past president of the Illinois Mental Health Counselor Association, signing out. And I'll see you all in the next video. Take care.